All right. Good afternoon, everyone. Thank you for joining us at the California Dialogue on Cancer Surveillance Data Webinar Series. My name is Sheila Senyao, Strategic Alignment Specialist for the Comp Cancer Program and the California Cancer Registry. Please feel free to introduce yourselves in the chat with your name, pronouns, organizations, and where you are joining from. I'll go over some housekeeping while everyone is typing in their intros. All participants have been muted, but we will leave the chat open for questions. We'll also have an allotted Q&A after speaker's presentation, so please stay until the end of the presentation to participate in a short live webinar evaluation. Again, for those who are just joining in, please type in your name, pronouns, organization, and where you're joining from in the chat. The California Comprehensive Cancer Control Program is a CDC-funded program that provides leadership for and coordination of statewide comprehensive cancer control efforts. The Comp Cancer Program leads the Cancer Control Coalition, which is CDOC, and the program is also required to develop and implement a state cancer plan. This is our current state cancer plan that we are implementing. And just to note, we are currently in the process of revising the next iteration of the plan. As a recap, these are the current cancer plan topic areas. The Cancer Registry works closely with CDOC to implement the current state cancer plan surveillance topic area. Given that the CCR is a principal resource for the development and evaluation of the state cancer control plan, objectives and strategies have been developed to strengthen its capacity to collect, process, analyze, and disseminate statewide cancer surveillance data. Today's surveillance data webinar, our CCR representative will present a report that utilizes an interactive map platform informing cancer control and prevention efforts about communities burdened by advanced stage breast cancers. With that, I'd like to introduce today's presenter. Vanessa Miguelino-Kisling is a research scientist for the California Department of Public Health in the Chronic Disease Surveillance and Research Branch. She has served as a research scientist for CDPH for just over 25 years. She holds a Master of Public Health degree in Epidemiology and Biostatistics from California State University, San Diego, and a Bachelor of Arts degree in Psychology from the University of California, Berkeley. Over the past decade, her work has included projects involved with the surveillance and research of cancer disease for the California Cancer Registry, as well as studying BRFIS survey outcomes related to chronic disease risk and prevention practices, once serving as the BRFIS coordinator for California. In her spare time, she enjoys cooking, home winemaking with her husband, and spending time with their two Great Danes. Please welcome Vanessa.
Well, thank you, and thank you for the nice introduction, Sheila. I'm glad everybody can be here for the noontime webinar. Can you all see my screen okay?
Yes.
Okay, great. So today I'm going to present on a report or project that was actually initiated several years ago, but the format was different, and we used to present individual static maps in PDF forms. And so over the years, we've kind of transformed this into a more interactive web map resource that hopefully for all of you will be useful and helpful for your work and your programs. So the title of my presentation is Advanced Stage Breast Cancer among women 40 years and older by medical services study area in California. And I'm just going to go over some background, the objectives for this project, the methods we used, and then some of the results that came out from this. So as most of you probably know, the California Cancer Registry was established by state law in 1985. The CCRs collected information on all new cancer cases and deaths for the entire state of California since 1988. And hospitals and physicians are required to report cancer cases to the CCR. And the CCR database contains currently 5.8 million cancer cases, with nearly 200,000 cancer cases added annually. So between 1988 and 2020, when this project was conducted, incidence and mortality rates in California have declined dramatically. Incidence rates have declined by 14%, and mortality rates have declined by 46%. The overall 5-year survival rate is 99% if caught in the early stages. So we can say that some of the reductions, both in incidence and mortality, can be partially attributed to early detection by breast cancer screening or by mammogram. So although cancer mortality from breast cancer has declined significantly overall, there are differences by racial ethnic groups. While mortality has declined among non-Hispanic whites, African Americans, and Hispanic women, overall mortality has increased among Asian and Pacific Islanders. Incidence trends, on the other hand, by major racial ethnic groups also differ. Again, while there's a decline among non-Hispanic white and African American women, there's an increase in incidence for breast cancer among Asian and Pacific Islanders and Hispanic women. So, despite the availability of effective screening rates, over a third of all breast cancer cases in California are diagnosed late, after the disease has already spread beyond the breast and survival rates will drop. From 2016 to 2020, we had 132,451 women, ages 40 years and older, that were diagnosed with breast cancer. Over a third of these breast cancer cases were diagnosed at advanced stage, where the disease has already spread beyond the breast. And then from BRFSS data combined from 2016 to 2020, BRFSS is, for those of you that don't know, is the Behavioral Risk Factor Surveillance System survey. 72% of California women aged 40 years and older reported having a mammogram in the past 2 years, while 81% that were aged 50 to 74 reported having a mammogram in the past 2 years. So some of the goals and objectives of this project that we looked at, we analyzed the California Cancer Registry data to look at medical service study areas with a higher proportion of advanced stage breast cancer to target and improve early detection and diagnosis. We developed an interactive map, which I'll demo in a little bit, that was used to hopefully help inform cancer control and prevention stakeholders to characterize communities burdened by advanced stage cancer. And then we utilized the BRFSS data. We tried to integrate this using their geographic data by counties to characterize cancer screening prevalence, and then some of the sociodemographic factors associated with advanced stage cancers, also to assist with improved breast cancer screening interventions. So the definition essentially for medical service study areas, an MSSA is, they are sub-city and sub-county geographical units that are used to organize and display population, demographic, and physician data. MSSAs were developed in 1976 by the California Healthcare Workforce Policy Commission, and that was in response to legislative mandates requiring it to determine areas of unmet priority needs for primary health, for primary care, family physicians, and geographical rural areas where unmet priority needs for medical services exist. So there are 542 MSSAs in California based on the 2010 census. They're still developing the MSSAs for the census, 2020 census. And all of the MSSAs incorporate U.S. Census total population, socioeconomic, and demographic data. They're composed of one or more complete census tracts, and they do not cross, MSSAs do not cross county lines. All the population centers within the MSSAs are within 30 minutes travel time to the largest populations. So as far as the methodology, in each of the MSSAs, we asked, out of all the female breast cancer cases diagnosed during the 5-year period, how many were diagnosed at late stage? Then we asked, how do those that percent and numbers of late stage breast cancer cases compare to our benchmark group or comparison group? And then how do cancer screening rates compare to MSSAs within counties with higher than average late stage diagnosed cancers? So our benchmark group, the comparison or benchmark group selected was non-Hispanic white females that resided in high socioeconomic status neighborhoods. And a person's SES status was determined using census indicators for income, employment, and education for the census block group. Then 23% of cases in the benchmark group were diagnosed at advanced stage. And then non-Hispanic white females in high SES neighborhoods were chosen as the comparison group because they have the lowest proportion of advanced stage breast cancer, in this case 23%, compared to other race, ethnicity, and income groups. So from the analysis, the proportion of breast cancers diagnosed at advanced stage in each MSSA was compared and mapped to the proportion of breast cancers diagnosed at advanced stage in the benchmark group. The differences in the age distribution of the two groups were taken into consideration. We tested the difference, if the difference was statistically significant, and then created separate layers on the map to represent MSSAs with statistically significant proportion of advanced stage breast cancer. And then we calculated the prevalence of women aged 40 years and older and at 50 to 74 years of age that reported having a mammogram in the past 2 years and mapped those results at the county level. So in our results, the proportion of breast cancer cases diagnosed at advanced stage was significantly elevated in 264, or 49% of the 542 MSSAs. Of those, 5 MSSAs had 50% or more of all breast cancer cases diagnosed at advanced stage. 34 had between 40 and 49%, and 225 MSSAs had between 27 and 39% of all breast cancer cases diagnosed at advanced stage. In 221 MSSAs, the proportion of breast cancer cases diagnosed at advanced stage was not significantly different than the comparison group. And then results were not calculated for 57 of the MSSAs where we had less than 15 breast cancer cases reported. Period. And then the BRFSS data, 67 MSSAs across 26 counties with significantly different proportions of advanced stage diagnosed breast cancer had lower breast cancer screening rates compared to the state overall breast cancer screening rate of 72% among women 40 years and older. So a couple of conclusions. The geocoded breast cancer data that can be used on an interactive map to display the medical service study areas with higher proportions of breast cancer cases diagnosed in advanced stage, and then lower mammography screening rates among MSSAs and counties with the highest proportions of advanced stage breast cancer may indicate areas of focus that may include sociodemographic and risk behavior characteristics of cancer control efforts and screening. So some of our next steps would be to evaluate the differences in the demographic screening behaviors and other social determinants of health that may be associated with advanced stage diagnosis. And then also we hope to map similar to breast and other screen preventable cancers, colorectal, cervical, and oropharyngeal. So now I'm going to stop sharing the screen and move to the demo. You all see this?
Yes.
Okay. So the link to this map basically opens up to this first page where you see an acknowledgement splash screen. And you just click OK to move it out of the way. Once you arrive at the initial platform, you'll see a window on the left-hand side, and it basically gives you a description of what the project was about, and it gives you live links. The first link being a map user guide, which will help the user. If you click on it, it'll open up to a separate PDF where you can follow along to realize how to navigate through the certain features of the map, the buttons up on top, on the left, and on the bottom. This can also be hidden with this arrow if you want to close and open that arrow. So this button here, you can zoom in and out, or you can, if you hit the home button, you can go straight back to the original map. This map is showing all of the MSSAs, these smaller areas outline boundaries of the MSSAs. At the top here, you can click on this legend to identify what all of the colors mean. If you close this and open the layer button, you can turn on and off particular layers for the map. If you click on this layer, so these, as I mentioned earlier in the presentation, the green highlights the significantly elevated late stage breast cancers. You can click that off, and you can still notice how these are still highlighted in the purple. If you go to the buttons down here at the bottom, these are informational buttons, and you can expand the whole window, move it around, pull down, and this actually describes the study itself. Gives you a lot of information on what I just talked about, the methods, results, compare the benchmark group. So if I click on the significantly elevated late stage, you can also, the second button in green, again, you can open this window, and this lists all of the all of the MSSAs that had statistically significant higher proportion of advanced stage breast cancers. And you can scroll and list these in descending order of the advanced stage percent. But then click off these layers and you click on the third layer. This is the breast cancer screening layer, again with the legend here. And you can look at the description here of the data that was used from screening behaviors from 2016 to 2020. It highlights some key takeaways from the data. And then you can also look at a table that looks at the characteristics by age, race, ethnicity, healthcare coverage, education, income, and then looks at the prevalence of having had a mammogram in the past year versus past 2 years among women 40 years and older. And then it also has a little trend graph that looks at the screening prevalence by race, ethnicity from 2012 to 2020. BRFSS only collects cancer screening on the every other year during the even year, so we don't have data in the odd numbered years here. So another feature of this map is you can pull up the attribute window with this little arrow that I clicked up and down here. Oops. And these demonstrate the different layers that I had up here. If you look at that breast cancer screening demo attribute table, you can see each of the counties, the percent screened between 40 and over 40 years and older, and then their 95% confidence interval, and then 50 to 74, and their 95% confidence interval. You can look at the advanced stage breast cancer. All of the data is listed here. You can go to options and you can filter, and you can add an expression and choose from the data in the table. So say you wanted to look at county is, and you put in county, and it will automatically filter just for all of the MSSAs that are in Sacramento County. So then it'll say at the very bottom here, it says 16 features. That means there's 16 MSSAs in the county of Sacramento. You can do the same. You just come back here to back the filter and cancel it out and do whatever other filtering options you'd like. You can also export all the data that you see. You can filter by the extent of the map, so that way it'll only show you in the table what you actually see in the map here. If you zoom all the way, it'll show you that there's 542, because there's 542 MSSAs. If you scroll in, and this is like all that you see here, it'll say but it's filtered by the map extent. It'll say there's 207 MSSAs that are displayed here. Also available, if you click on any of the actual MSSAs, you can see all of the characteristics for that MSSA. This is saying this is the percent diagnosed advanced stage and the proportional incidence ratio for this particular MSSA. It'll list their ID, the description, county, the percent that were diagnosed advanced stage, the total cases, observed or expected. It gives you the proportional incidence rate, the confidence interval for that. And then it also displays the percent of by race ethnicity within that particular MSSA. If you change, click on the other layers, and you click on a particular county. This is the BRFSS screening layer. Again, you can see this is the percent screened for breast cancer among women 40 years and older that had a mammogram in the past 2 years for this county. And then you would have the percent here screened, the confidence interval, and then the percent screened among women 50 to 74. And again, the confidence interval there. And then what I was going to show you was like Fresno, say for example, they have a 60.9% screening rate, and among their, if you were to look at the advanced stage and you type in and you filter for, say, filter, and is Fresno, you'll see that there are 14 MSSAs just for Fresno, and you can look at the legend again and look to see that there are all, I think, but 2 that are basically significantly higher portion of advanced stage cancer, where their rate was, a screening rate was 68%, as we saw on the other BRFSS map, the Fresno County. And hopefully that would indicate, or 60.9, as I correct myself, but the overall rate in California is 72%. So they have a lot lower screening rate, and many cases, that was 12 out of 14 MSSAs that were diagnosed at advanced stage. The other features of this map, you can print. You can print, it's taking a while to load, but you can print screen whatever it is that you see on the extent. If you want the whole map, if you want to just go in and out, zoom in and out to whatever counties or whatever you select. I don't know why that's not loading, but it allows you features to print, and it allows you to share. So you can actually copy the link to this map, or you can embed it in other things if that is useful to you. And I think that's all I was going to cover. Hopefully, stop sharing and take any questions. Hopefully that map is useful to you. We are hoping to transform the platform a little bit more. This particular platform is called Web App Builder, built on ArcGIS platform. And they're going to be expiring or retiring this particular platform, but I am working on enhancing the same features. If you all think that this is something that is useful to you all, we're hoping to enhance it in a similar but different type of ArcGIS platform. Soon to come. But thank you.
Thank you so much, Vanessa, for sharing the report and walking us through the web map tool. I'd like to now open for any questions or comments. Thank you for the comment, Jessamy. I see Dhruvi. Did I say your name right? Go ahead and unmute yourself.
Yes. Hi, can everyone hear me? Thank you so much, Vanessa. This was an amazing tool and presentation. It's so helpful to have you walk through how to use the map and how the MSSAs help you look at what's happening in your county in a more granular level. Here at UCLA's Center for Cancer Prevention, we're trying to map out LA County at a more granular level too, because of course there is so much variation even by zip code and census tract here. And I know you mentioned earlier that you're thinking of evaluating differences by other sociodemographic data and social determinants of health. And I was wondering if you all have plans or if that's an objective to maybe add some of those factors on as layers to a map, or how that might look, to think about what those other social determinants of health factors are playing a role in these inequities that we can see on the map. Thank you.
Most definitely. I mean, that's kind of where we were heading towards in terms of when I mentioned we're looking to enhance the whole visualization on the different platform. This web app builder that I used for this particular presentation, as I said, was being retired, but it has a few limitations, as does some of the data as far as the behavioral risk factor surveillance system as far as geographic level information. We collect county and zip code. Mm-hmm. And zip code, I'm not sure if you know this, but it's not an exact, it's not very good geographic or just, you can't really look at geographic differences by zip code, because zip code is are basically routes for the Postal Service. So they don't really line up with actual behaviors that occur in those areas. So trying to overlay the sociodemographic data from BRFSS that we can collect over cancer data is a little bit difficult, because we have census tract and census block information with cancer data, but then we don't have that for the BRFSS data. But I'm hoping in the more enhanced platform that I can incorporate both all in some type of visualization that you can easily compare, maybe by county or side by side, to be able to look at some of those, some of the things that we collect from BRFSS, but that's all behavioral risk. We can look more into some of the risk factors for behaviors, as well as they have other data sources for social determinants of health that might be available for census tract information that we might also be able to look. They have a lot of sources now focus on social determinants of health. So I'm hoping in coming time that we'll be able to pool all those together for one map. So, thanks for that question.
Yeah, thank you. That's helpful.
We also received a comment from Anne. She said that it's a very helpful tool, and she'll share it with the NAB, PBC, BPLC, and their cancer committee.
Great.
Thank you, Anne. Don't see any other question, but what you see in our screen, hopefully please help us. Oh, let me see in the chat. Yes, we'll be sharing the slides after the webinar. Thank you. So please help inform the Cancer Registry and our team of how useful the web map is. You can use your smartphone to scan the QR code as you see on the screen, and then it will take you up directly to a short survey, or if you prefer, you can type in your browser the menti.com and enter the QR code that you see there. And I will also drop the instruction on the chat. Thanks for participating in our evaluation. Thank you, Terrence. Do we have any other questions, comments? Thank you. Everyone says great presentation, Vanessa. Thank you for sharing again.
Thank you all.
All right. Thanks everyone, and enjoy the rest of your week.